Now you're ready to assess the patient's head and face. First, inspect the head and face. They should be normal in size, shape, symmetry, and contour. Look at the patient's hair and note its distribution, quantity, texture, and color. The hair should not be extremely dry or oily and should not contain scales or nits. Next, palpate the patient's scalp, which should be pink, mobile, and free of lesions. You may feel bony prominences in the forehead, in the sides of the parietal bones, and behind the ears. These are normal. Using the tips of your middle and index fingers, palpate the temporal arteries. Their pulsations should feel equal. Listen for bruits over the temporal arteries. You should not hear any. Next, press your thumbs under the inner aspect of the orbits to palpate the frontal sinuses. And press under the zygomatic bones to palpate the maxillary sinuses. Then lightly percuss these areas. Palpating and percussing the sinuses should not cause pain or tenderness. If they do, assess the sinuses further with transillumination. Move your fingers to the patient's temporomandibular joints. As you palpate with your middle fingers, instruct the patient to open and close his mouth. The joints should move freely and painlessly. This technique assesses joint mobility and the motor function of the trigeminal nerve. To test the facial muscles and the motor portion of the facial and trigeminal nerves, have the patient raise and lower his eyebrows, bare his teeth, smile broadly, puff out his cheeks, and keep his mouth closed as you try to open it. All of these movements should be symmetrical. If the patient reported problems with his sense of taste during the health history interview, test the sensory portion of the facial nerve by having him identify sweet, sour, bitter, and salty substances. To assess the sensory portion of the trigeminal nerve, test the patient's ability to identify simple touch. Instruct him to close his eyes and to tell you the moment he feels something touching his skin. Check for simple touch sensations on both sides of the patient's forehead, cheeks, and jaw. The patient should feel the sensations equally on either side of his face.